So we chose to research breast cancer as our final presentation topic. I'm Rachel.
I'm Dan.
I'm Regina.
And I'm Grace, and I will be going over the general definition of breast cancer and what some of the causes are. To start off, some statistics of breast cancer is that it is the most commonly diagnosed cancer among women in the United States. It is the second leading cause of death in women in the United States, and about 89% of deaths occur in women aged 50 and older. Breast cancer can be defined as a cancer that starts in the breast cells. Cancer in general is a class of diseases that are characterized by abnormal cell growth and that take over healthy cells. These cancer cells start in the breast and then spread, or what is called metastasize, to other parts of the body, and this is what causes the cancer to become fatal. What causes the cancer is that sometimes when cell growth does not go as it should, certain cells do not die when they should and do not replace old cells. As these processes occur, cells build up and a mass of tissue called a tumor forms. Breast cells specifically develop when malignant tumors are formed in the breast. These cells metastasize when they break off from the original tumor and enter into the blood and lymph vessels. At this point, the cancer becomes fatal.
Breast cancer occurs at the cellular level by way of mutation. A change in the original coding of DNA in a cell is called a mutation. Mutations may occur randomly or by substances in the environment called mutagens. Breast cell mutations have the potential to cause breast cancer. Mutations. They interfere with the genetic code of a cell that produces the specific proteins that are required for cell function. This is inherited by the daughter cells, which will inhibit the ability of the affected cells to properly function. This may cause programmed cell death, and it usually causes uncontrolled cell production, which will just produce a mass of cells that are not functioning correctly. A large group of cancer cells may develop into a malignant tumor. Normal versus abnormal cells. Normal breast cells act like many other cells in the body. They go through the cell cycle, they reproduce by mitosis, and they're regularly checking their own cell division. Cancerous breast cells, potentially inhibited cell cycle, accelerated cell division, uncontrolled cell growth, programmed cell death, and a mass of these cells could develop into a tumor.
Warning signs and symptoms of breast cancer include a lump in the breast, bloody discharge from the nipple, changes in the shape or texture of the nipple or the breast. Some can also experience no symptoms but may experience breast discomfort, inverted nipples, redness, or swollen lymph nodes. When diagnosing breast cancer, tests and procedures used to diagnose the breast cancer can include a breast exam, which your doctor will check both of your breasts and lymph nodes in your armpits, feeling for any lumps or other abnormalities. A mammogram. A mammogram is an X-ray of the breast. Mammograms are commonly used to screen for breast cancer. A breast ultrasound. Ultrasound uses sound waves to produce images of structures deep within the body. Ultrasounds may be used to determine whether a new breast lump is solid, mass, or a fluid-filled cyst. Removing a sample of the breast cells for testing, which is a biopsy. A biopsy is the only definitive way to diagnose breast cancer. During a biopsy, your doctor uses a specialized needle device guided by an X-ray or another imaging test to extract a core tissue from the suspicious area. Breast magnetic resonance imaging, which is an MRI. An MRI uses a machine which uses a magnet and radio waves to create pictures of the interior of your breast. Tests and procedures used to stage the breast cancer include blood tests, such as a complete blood count, a mammogram of other breasts to look for signs of cancer, a breast MRI, a bone scan, and computerized tomography, which is a CT scan, and a piston emission tomography, which is a PET scan.
So depending on your age, the type of breast cancer, the size of the tumor, or the stage of cancer, there are different treatments that can be used. There's So the pharmaceutical treatments are chemotherapy, hormone therapy, and targeted therapy. These therapies are usually used along with surgery or radiation therapy. So chemotherapy treatment includes a medication or combination of medications that treat cancer. Their goal is to stop or slow the growth of the cancer cells, and they attack the rapidly growing cancer cells but can also affect your healthy normal cells, which can cause bad side effects. Hormone therapy uses drugs to prevent hormones from fueling the growth of breast cancer cells. Different medicines are used depending on your age. Targeted therapy are medicines that prompt the body's immune system to destroy cancer. They target breast cancer cells that have high levels of a protein called HER2. Different medicines work by blocking a substance that promotes cancer growth. Different surgical treatments can also be used as well. Most women with breast cancer have some type of surgery done. There are different types of breast surgery, and it may be done for different reasons depending on your situation. So there's a mastectomy, which is a procedure to remove your whole breast or as much of the cancer as possible. And a lumpectomy, which is also called breast reconstructive surgery, which is a procedure that removes the tumor and tissues surrounding it. The goal is to remove the cancer as well as some surrounding normal tissues. However much of the breast is removed depends on the size and location of the tumor and other factors. And radiation therapy is high energy waves that kill cancer cells. So different lifestyle changes are important when trying to prevent breast cancer or prevent it from coming back. This includes controlling your weight, discontinuing alcohol consumption, stop smoking, exercise, and eating right. So overall, breast cancer can affect many women throughout the U.S. It is the most commonly diagnosed cancer in the United States for women. The steep declines in breast cancer death rates since 1989 have been attributed mostly to improvement in treatments and diagnosing early, like from a mammogram. But by living a healthy lifestyle and noticing your warning signs early, getting the proper diagnosis and treatments done, breast cancer can be a treatable cancer.